Hello, my name is Daryl Hominick. I'm the Director of Programs and Services and Government Relations for the Multiple Sclerosis Society of Canada, Manitoba Division, and I'll be speaking today about MS 101. The mission of the Multiple Sclerosis Society of Canada is to finding a cure and enabling people affected by MS to enhance their quality of life. There are several topics that we're going to be discussing today. Among them will be what is MS, the causes of MS, who gets MS, how is it diagnosed, and what is an attack, the types of MS, along with symptoms, treatments. We'll be talking about research, what are the issues surrounding MS, and resources. So what is multiple sclerosis? MS is currently classified as an autoimmune disease of the central nervous system. This includes the brain and spinal cord. So what's happening in the nervous system of a person living with MS? Please keep in mind that we still don't know enough about this disease, and the information I'm about to provide is based on the current level of knowledge available. The central nervous system is responsible for everything that makes us think, feel, and be mobile. Different parts of the nervous system control different functions, so damage to a particular area results in a loss of a particular function. For instance, if the nervous tissue in the eye is destroyed, a person would lose vision in that eye. To understand MS, one needs to understand how the nervous system works. In the gray matter of the brain, neurons communicate by sending electrical messages. The messages travel along a part of the neuron called the axon. Axons are found in the white matter of the brain. The neuron connects with other neurons by sending a message across a gap called a synapse. So, nerve messages travel along axons the way phone signals travel along a phone wire. Think of billions of interconnected electrical wires creating a system of linkages. It sounds complex, and the human nervous system is just like that. Just as phone wires require insulation, so do axons. Axons are covered in a fatty protein called myelin, and myelin is necessary for the transmission of nerve impulses through nerve fibers. Now I'm going to take a big jump here. For reasons unknown, the immune system attacks the body's own myelin. It strips the myelin from the axon and often destroys the axon that is causing MS. This is why MS is seen as an autoimmune disease of the central nervous system. So what is happening in the central nervous system? So we know that T lymphocytes migrate into the nervous system and attack myelin, the protective covering of the nerves, which causes inflammation and often damaging or scarring the myelin. This may occur because the immune system mistakes myelin as a virus and attacks it, causing the scarring. If damage to myelin is slight, nerve impulses travel with minor interruptions. However, if damage is substantial, and if scar tissue replaces the myelin, nerve impulses may be completely disrupted, and the nerve fibers themselves can be damaged. The protective myelin covering allows nerve cells to effectively carry messages to action parts of the body, such as the eyes or muscle in the hands or legs. When the myelin becomes scarred, and this is known as demyelination, the usual flow of nerve impulses along nerve fibers to the rest of the body become interrupted or distorted. The result may be a wide variety of MS symptoms, depending upon what part or parts are affected. Much like no two snowflakes are alike, the same could be said about MS. No two people with the illness follow the exact same course. The severity of MS, progression, and specific symptoms cannot be predicted. In fact, the most predictable feature of MS is its unpredictability. What are the causes of MS? Despite decades of research, the cause remains a mystery. The best current evidence suggests that lifestyle, environmental, genetic, and biological factors all contribute. All these areas are being actively examined. Studies funded by the MS Society are asking if certain risk factors, such as gender, age, family history, or lifestyle habits, impact a person's susceptibility to MS. Let's talk a little bit about gender. It's primarily a disease of young adult women. It is approximately 3 times as common in women as men. The reason is not clear. However, autoimmune diseases in general are more common in women than men. Racial group. While MS occurs in all main racial groups, it occurs more frequently in Caucasians of Northern European descent, which includes Canada, US, Australia, and New Zealand. Interestingly, it is uncommon in Northern Australia, Southern US, and South Africa. This would suggest that racial group alone is not the sole factor in the onset of MS. Latitude. Countries furthest away from the equator have higher rates of MS. Canada has the highest rate of MS in the world. As mentioned, the Northern US, Northern Europe, and Northern Japan, for example, have higher rates than their southern counterparts. Rates of MS in Australia are higher in the south than the north because the climate is cooler in the south. This is because Australia is in the southern hemisphere. The reason for this appears to be the sunshine and its effect on vitamin D synthesis. Family. There is no evidence that MS is directly inherited disease. A number of genes are probably involved in making some people more susceptible to MS. The risk of developing MS is only 3% higher for family members of people who have MS. In order for it to be considered a hereditary disease, there would have to be a 30 to 50% risk of transmission to offspring. And finally, infections. MS could be triggered by a common virus or other environmental factors. Possible factors include climate, such as temperature, UV radiation, precipitation, humidity, smog, diet, and living conditions. It may be a delayed reaction to a virus contracted during childhood. Human viruses may include measles, parvovirus, hepatitis B, Epstein-Barr virus, and common respiratory viruses. MS is Canada's disease. In fact, an estimated 100,000 Canadians live with MS. It affects approximately 1 person in 500 to 1 in 1,000 cases across Canada, and approximately 1,000 new cases of MS are diagnosed each year in Canada. It is the most common neurological disease diagnosed in young people, and children as young as 3-year-old have been diagnosed with the disease. The prevalence of MS in Manitoba is increasing. In 2015, the estimated number of people living with MS in Manitoba leapt from 3,000 to 3,500. MS is increasing among women and has been increasing in Canada for the last 60 years. The factors causing the increase are speculative. Factors may be environmental in nature, perhaps resulting from gene-environment interaction. Who can get MS? Let's talk a little bit about age. As we know, it affects young adults between the ages of 15 and 40 years of age. It is estimated that MS affects 100,000 Canadians. Studies suggest that 1 out of the 1,500 people who are diagnosed with MS in Canada each year, approximately 3% of MS patients are under the age of 16, and about 41 new pediatric cases of MS are diagnosed in Canada each year. The youngest person in Manitoba affected by MS was diagnosed at age 10. MS is usually diagnosed during the career and family building years. Gender. Autoimmune diseases such as MS are more common in women if diagnosed later in life, over 40 years. Men are as likely as women to have a progressive form of the disease. Ethnicity. Although MS occurs in all main racial groups, it is much more frequent in Caucasians. Caucasians account for more than 90% of all people with MS. In contrast, so how is MS diagnosed? Several tests may be used, as it is difficult to diagnose with just a single test. Because symptoms are so vague or mild, time is often needed to make a definitive diagnosis. Medical history and examination. These are fundamental to the diagnostic process of MS, and diagnosing MS often requires the expertise of a neurologist. A neurologist is a specialist in diseases of the central nervous system. The examination typically starts with a medical history that seeks to identify symptoms that led to the medical consultation. Magnetic resonance imaging, also known as MRI. If suspected of having MS, a person will undergo an MRI, which is an imaging of the central nervous system and is the most useful diagnostic test. The patient will lie down for 15 to 30 minutes and will identify areas of any abnormalities in the brain and spinal cord, both areas that have an abundance of myelin. So how is the diagnosis confirmed? As mentioned, the MRI, evoked potentials, and occasional lumbar punctures can help to detect scars, also known as lesions, that have formed on the brain or spinal cord. All may be useful when a diagnosis of MS is suspected. A diagnosis of MS must include evidence of disease activity separated in 1. Time, and that's when lesions that have formed at different points in time, and 2. Space, lesions in at least 2 separate areas of the central nervous system. Sometimes this means that it can take time for diagnosis to be confirmed. It is important to remember that there is no one test that can be used to diagnose MS. The diagnosis of MS is one made only once other potential causes for symptoms have been ruled out. So what is an MS attack? An MS attack is also known as an exacerbation or a relapse. An attack is the appearance of new neurological symptoms or the worsening of old neurological symptoms. Most people with MS experience attacks. Symptoms will ebb and flow per person, but generally include pain, numbness, dizziness, and imbalance. The frequency, duration, and severity of attacks vary dramatically from one person to the next. An attack lasts at least 48 hours and for an average of 3 to 4 weeks, and occurs without fever or illness. This is important to know because a fever or illness can cause hidden symptoms to come about and without warning. So once the fever subsides, so do the symptoms. Each person will have attacks that vary in symptoms and duration and are classified as mild, moderate, and severe. For instance, new weaknesses in the hand would be considered mild. New weaknesses in the arm or leg would be considered moderate. And new weaknesses in the arm or leg with pronounced difficulty coordinating limbs or gait would be severe. While attacks are usually unpredictable, there are certain triggers that can cause the relapses for others. To help avoid an attack, a person can moderate their stress, stay away from situations that can worsen MS, such as physical activity, and keep clear of viral infections. How does a person manage an MS attack? Well, attempting to work through a relapse can actually prolong recovery. So knowing this, it's important to rest and avoid strenuous physical activities. It's time for the person to relax and charge their batteries. Within weeks or even months, the attack subsides and a person's condition will improve. On average, about 60% of people will recover by 8 weeks. A mild attack does not often require drug therapy. Moderate and severe attacks usually involve steroid therapy called corticosteroids. These can be taken orally or injected intravenously. We're going to be talking about the 4 types of multiple sclerosis. The most common form is relapsing-remitting MS. Studies indicate that about 75% of people with MS initially begin with a relapsing-remitting course. You can see from this chart that there is little to no worsening between attacks, and is typically followed by full or partial recovery over a period of several years. It's important to note that women are more than 3 times likely than men to have this type of MS. The second type of MS is secondary progressive MS. Most people with relapsing-remitting MS develop secondary progressive MS, where the disease becomes more progressive. Because of the unpredictability of MS, people with relapsing-remitting disease develop secondary progressive MS within 5 to 25 years. You can see from the chart that it begins with a relapsing-remitting disease course, which later becomes more progressive over time. Studies indicate that of those who start with a relapsing-remitting disease, 50% will develop secondary progressive within 10 years and 90% within 25 years. Primary progressive MS appears in people primarily in their 40s and is the only form of MS that affects men and women equally. You can see from the chart that primary progressive MS is characterized by a steady progression of disability from onset without relapses. Studies indicate that approximately 10 to 15% of people with MS experience this type of disease course. The fourth and rare subtype of primary progressive MS is progressive relapsing MS, in which relapses occur during a course that is progressive from the onset of the disease. Moving on to symptoms. Before we talk about MS symptoms, please know that not all health problems are caused by MS. Studies indicate that patients with MS often have other chronic medical conditions, with fibromyalgia, inflammatory bowel disease, and epilepsy being common physical comorbidities, and depression and bipolar disorder the most common psychiatric comorbidities. A study led by Dr. Ruth Ann Mary of the University of Manitoba found some interesting sex differences. In particular, women with MS were more likely to have chronic lung disease, while men with MS had a disproportionately higher prevalence of hypertension, diabetes, and epilepsy. In addition, she noted that the burden of psychiatric morbidity for both sexes was striking. Having said this, these comorbidities require clinical attention from the time of diagnosis and support the need for continued studies so as to improve diagnosis and management of these conditions. Symptom management is an essential component of comprehensive MS care. Given the wide variety of neurological symptoms that can occur in MS, attention to care is the key to effective management. Symptoms of MS are unpredictable and vary greatly from person to person and can fluctuate within the same person from one time to the next. There are a wide variety of MS symptoms, both invisible and visible. Depending upon what part of the central nervous system is affected, not all people with MS will experience all symptoms, and often the symptoms will improve during periods of remission. There are a variety of ways to manage symptoms, ranging from pharmacological treatments to non-medicinal strategies such as physiotherapy, occupational therapy, exercise programs, and alternative and complementary medicines. This is a list of some of the more common MS symptoms, which include the invisible symptoms: extreme fatigue, vision problems, sensory dysfunction, cognitive impairment, bowel and bladder problems, pain, and depression. The visible symptoms include motor functions such as walking, muscle weakness, spasticity, and tremors, speech problems, and a lack of balance and coordination. Because of the myriad of symptoms, only a few will be discussed today. The first is fatigue, and is the most disabling symptom. MS fatigue can be one of the most disabling symptoms of MS, affecting up to 90% of people with MS, and is one of the key factors affecting quality of life. Fatigue can be a primary symptom due to active inflammatory disease, or a secondary symptom which is the result of other symptoms or conditions, such as sleep disorders, depression, or muscle weakness. Fatigue as a primary symptom is thought to be the result of damage that occurs to the central nervous system. The exact cause of fatigue in MS is still unknown. However, it does not appear to be related to age, gender, the length of time an individual has been living with MS, or level of disability. Fatigue as a secondary symptom is caused by other conditions or factors related to the disease, such as urinary dysfunction, pain, spasticity, and sleep problems. In addition, poor diet, lack of physical activity, dehydration, and certain medications can also contribute to fatigue. The prevalence of fatigue in MS is high. The good news is that fatigue can often be improved by employing energy-saving techniques, making lifestyle changes, and taking certain medications. To conserve energy, one should prioritize the most important activities first. Then plan all necessary activities efficiently without wasting time or energy. Then pace oneself by working for short periods of time and then resting. And the person should be patient with themselves and encourage others to be patient with them as well. Occupational therapists can often help by providing advice on how to plan, simplify work, and perform activities efficiently. There are several medications that can help to alleviate fatigue in MS. These typically include amantadine, modafinil, and a type of amphetamine. These can be helpful, but do not work for everyone. As a side effect, these medications can also result in insomnia. This should not be surprising, as these medications typically function as stimulants. Balance and dizziness. Balance and vertigo or dizziness problems are common in MS, and their management can be difficult. It's caused by lesions in the areas that coordinate visual, spatial, and other input needed to produce and maintain equilibrium. Balance and dizziness may present as symptoms of a relapse or may be permanent. Impaired balance and impaired reflexes can pose increased safety risk for falls. In managing it, some balance problems can be overcome with a walking aid. Walking aids should only be used with the instruction of a trained professional to ensure proper gait alignment. A home assessment for safety conducted by an occupational therapist can be helpful to identify potential hazards and to suggest strategies for a safe approach to activities of daily living. Moving on to cognitive impairment. MS has the potential to affect brain function, personality, and emotions, and intellect, otherwise referred to as cognition, either directly or indirectly. Cognition is sensitive to many potentially disruptive factors, including normal aging, disease, or injury. It can also be affected by tension, emotional stress, depression, sleep disturbance, menopause, low blood sugar, medications, substance abuse, or fatigue. Many of these factors can and do occur in combination. Between 40 to 70% of people with MS will develop problems with cognition. Cognitive changes can be one of the earliest manifestations of demyelination associated with MS. Let's talk a little bit about treating MS. Currently, there are 14 disease management therapies approved by Health Canada for the treatment of relapsing-remitting MS. I'm not going to go through each one of these, but you can see that they're broken up into oral, injectables, and IV infusion. So, if it is the ongoing management of symptoms that allow people living with MS to function in their daily lives with optimal comfort, safety, participation, and quality of life, then it is the disease management therapies that reduce disease activity and slow progression for many people. There are a class of drugs that impact the underlying disease. Disease management therapies target some aspect of the inflammatory process of MS and reduce the frequency and severity of attacks, reduce the number of new lesions in the brain and spinal cord as seen on the MRI, and slow down the accumulation of disability. Because of the way these medications work, they are used for treatment in individuals with relapsing-remitting MS and secondary progressive MS with relapses. Unfortunately, no disease-modifying therapies have yet been approved to treat primary progressive MS, the type of MS that shows steady progression at onset. These medications, which are generally taken on a long-term basis, are the best defense currently available to slow the natural course of MS. Decisions about taking a disease-modifying therapy are best made by carefully considering and weighing factors including individual lifestyle, disease course, known side effects, and the potential risks and benefits of the different therapies. As you can see, the MS Society funds several areas of research, and this includes myelin repair, virology, pediatric MS, MRI studies, immunology, health and treatment, genetics, and stem cells. Because of the many areas of research funded, a few will be discussed. The unique properties of adult stem cells make them promising candidates for treatments that can slow MS, disease activity, and repair tissue damage in the central nervous system. While there are no approved stem cell therapies for MS, there is encouraging research underway to determine how stem cells work and whether the use of stem cells to treat people with MS is safe and effective. The discovered potential of mesenchymal stem cells in treating MS has been culminated in the launch of an international study called MESCAMS, that is, mesenchymal stem cell therapy for Canadian MS patients. Funded in part by the MS Scientific Research Foundation, the Foundation of the MS Society of Canada, Research Manitoba, and A&W Food Services of Canada, Inc., a Phase 2 clinical trial is being performed in Manitoba by Dr. James Marriott of the University of Manitoba. The aim of the study is to determine if treatment with autologous mesenchymal stem cells, that is, cells originating from the same person receiving treatment in people with MS, is safe, can reduce harmful inflammation in the brain, and possibly contribute to the repair of the central nervous system. The MESCAM study is the first Canadian clinical trial evaluating the safety and efficacy of mesenchymal stem cells as a treatment for MS and marks an important step forward in MS research and treatment. The MS Society is currently funding 10 studies dedicated to finding answers about myelin repair, also known as remyelination. The effective and timely repair of myelin, which I mentioned earlier is the insulation wrapped around nerve fibers in the central nervous system, is critical to avoiding exhaustion of nerve cells and further damage to tissue. Remyelination is a complex and time-sensitive process. Once a window of opportunity for myelin repair has passed, the ability for the nervous system to undergo repair decreases significantly. Thus, it is important to know exactly when and how repair can take place. Remyelination may also protect the axons from vulnerability to further damage by immune cells. Recent research using mice with an MS-like disease has shown that axons that have been repaired appear to be protected from future degeneration. Whether this effect lasts over a long period of time is yet to be determined, but this evidence demonstrates that remyelination is a key step in reversing damage, preventing progression, and improving physical recovery in all forms of MS. While the development of therapies that encourage myelin repair is gaining more traction in the MS research community, many questions remain. Innovative work, such as Dr. Simon Zohornitsky's MS Society-funded research on the remyelinating abilities of an antipsychotic drug, have been conducted. However, more research is needed in this field to uncover new therapies that would enhance repair of nerve damage in people with all forms of MS. So, MS research continues to advance knowledge of the disease and treatment for people with MS. There is much greater understanding of this unpredictable, often disabling disease, and many of those accomplishments have taken place in the past 40 years, thanks to the support of the Multiple Sclerosis Society of Canada. Manitoba has achieved significant milestones in representing MS research. In 2009, our province, in collaboration with Ontario, was selected to be one of 5 NMS regional research and training centres in Canada. Co-directed by Dr. Ruth Ann Mary of the MS Clinic in Winnipeg, this virtual entity represents a defined geographical area that will serve as a key operational centre on, among things, increasing the capacity to conduct MS research. In addition, in 2016, Dr. Ruth Ann Mary was appointed as the Waugh Family Chair in Multiple Sclerosis Research at the University of Manitoba. The chair was established as a result of an investment of $1.1 million of provincial funding and a $2 million gift to the Front and Center campaign from the Waugh Family Foundation. We are very proud to partner and support MS research excellence here in Manitoba. As you can see, there are a number of areas that MS affects. The issues include accessibility, housing, financial, healthcare, employment, family impact, and aging. Because of the many areas, only a few will be discussed. It's worth noting that there is no single best way to deal with MS. Whatever works for you and your loved ones is often the best. Let's talk a little bit about employment and MS. While a diagnosis of MS is not necessarily a reason to be unemployed, the disease at some point can make it difficult or impossible to maintain regular full-time employment, as it may result in the need to take increased sick time due to the physical and/or cognitive inability to perform job tasks, insufficient stamina, and the ability to do a job at acceptable rate or capacity. People often ask if they should disclose their diagnosis to an employer. Unfortunately, there is no right or wrong answer. If employers know about the disease, they may be more understanding and can accommodate their worker as best as possible. On the other hand, because many symptoms are invisible, other employers may be less understanding and resent the employee for so many absenteeisms. The person with MS should be comfortable when deciding to disclose to their employer. Unemployment is the expected outcome eventually for most people with MS. Statistically, on average, 25% will stop working within 5 years of diagnosis. 50% will stop working within 10 years, and 80% will stop working within 20 years. As per the Human Rights Code, an employer has a legal responsibility to accommodate an employee up until the point of undue hardship. Accommodations at work can include, but are not limited to, flexible work hours, special equipment, accessible washroom, wheelchair ramp, and so on. MS impacts the family. It is a disabling and unpredictable disease, and MS has a major impact on family life. Because it is a disease affecting young people, it impacts people when they are in their education and career building years and or early stages of family life. MS affects physical, emotional, and cognitive well-being of persons with MS. There's a loss of independence, control, and an increased demand on family and or caregivers. The person living with MS isn't the only person affected. Family members, including the partner and children, can also experience worry, guilt, and resentment. For instance, the partner sees the person with MS as needier and less capable than the person he or she committed to. The partner has a changing role as a caregiver, and the tasks change, which can cause fatigue and burnout. Children often fear for their parents' health or that the parent will die, although MS is not a fatal disease. On the other hand, children become frustrated and embarrassed that their parent is unable to keep up with them as parents of other children do. Children's roles also change where they have increased responsibilities in caring for the parent. This often impacts performance in school. Common with the entire family is uncertainty of the future, guilt, and fear. However, support does exist. Living with uncertainty and adjusting to a new reality is difficult. While it's not easy, thousands of people living with MS have accomplished it. It's possible to have a good quality of life while living with the daily challenges that MS brings. Besides ensuring that a person obtains all valuable treatment possible, one should not allow MS to become the sole focus of life. I often hear people with MS saying, "I have MS, but MS doesn't have me." A person can still take part in many activities that others enjoy. While it's common sense to do all things in moderation, it's also important to build a social network of support. This includes family, friends, and professionals in their community. The MS Society is here to help. We provide information, support, referrals, and advocacy. We're an excellent source of information about the disease and can help a person to cope better with the disease. A little bit about MS Society programs and services. The MS Society Manitoba Division is committed to providing quality programs and services to Manitobans living with MS throughout the province. Our programs are designed through the input of people living with MS and in response to our mission to enhance quality of life. We provide programming in 3 areas. The first is support, the second is education, followed by wellness. Under support, we offer self-help and support groups. We have 17 groups throughout Manitoba that people can participate in and connect with others to discuss issues of importance. Under education, people can gain new information about MS through webinars, through over-the-phone education sessions called MS Talk. We also offer in-person education sessions throughout the course of the year, and every second year in Winnipeg we offer the MS Connect Conference. We offer a plethora of wellness programs aimed at enhancing quality of life. These include, but are not limited to, yoga, massage therapy, Tai Chi recovery class, eccentrics, standing and floor Pilates class, adapted aquatics, social and recreational programs. We also offer the young adults program called The Heart of It. Finally, we offer a financial program called the Quality of Life's Equipment Grants Program. This program provides a maximum of $300 per person per year to purchase needed equipment. On top of programs, we also provide services in the areas of support and information. The MS Society has a centralized knowledge network composed of highly trained MS navigators that provide support and information to callers from across the country, Monday through Friday, 8 hours per day. People can connect via phone or email. Information on these programs can be found by visiting www.mssociety.ca. The MS Society is 97% self-funded. Our work in finding a cure and enhancing quality of life for people living with MS is supported by donors, event participants, corporate sponsors, volunteers, and staff from coast to coast. You can be part of this dynamic group of Canadians by getting involved in the fight to end MS in any of the following ways. You can provide a one-time gift. You can volunteer, participate in social advocacy. You can become a member, join a special event, become a corporate sponsor, or donate securities. We need your help to ensure the future is one free of MS. This means that we rely on the donations of generous people and organizations within the community, as well as our annual events, to raise the money needed for research and programs and services. The MS Society has a number of core events which include 7 MS walks in May and 2 MS bikes in September. Our consolidated target goal for each core event is about $500,000. Our third-party events raise about $5,000 per event, and several are offered throughout the course of any given year. The MS Clinic is located at the Health Sciences Centre in Winnipeg and is seen as a centre of excellence across Canada. The MS Clinic works with family physicians, referring doctors, and community agencies such as the MS Society to provide quality care to persons affected by MS. The MS Clinic team members include neurologists, nurse clinicians, clinical nurse specialists, physiotherapists, occupational therapists, dietitians, and clinical pharmacists, social workers, and a bladder clinic nurse. The Multiple Sclerosis Society of Canada, Manitoba Division, is located at 100 1465 Buffalo Place. You can reach us locally at 204-943-9595 or toll-free at 1-800-268-7582. As mentioned earlier, the Multiple Sclerosis Clinic can be found at the Health Sciences Centre downtown in Winnipeg. Thank you so much for attending this webinar.